Hello, I'm Dr. Pamela Ruegg. I hold the David J. Ellis Chair in Large Animal Clinical Sciences at Michigan State University. And in this video, I'll be talking about the use of diagnostic tests to help us in mastitis control. Now, mastitis continues to be the most common and costly disease on dairy farms, and it remains an important disease even though we've cut out subclinical mastitis by about half in the last 20 years. But this tricky disease is caused by a variety of bacteria that have differing clinical presentations. So diagnosing it before it becomes a problem is the key to minimizing its impact. To do that and to properly diagnose it, we have to select and understand the differences among the diagnostic tests that we have access to. Now, we have a bunch of tools in our diagnostic toolkit, and there's different ways to test for mastitis, and we have to know when to use each of those tools. Our modern udder health programs have access to both some older tools like observation of foremilk for clinical mastitis and the California mastitis test to diagnose subclinical mastitis, and modern technologies like DNA tests. All of these tests can be categorized into three broad areas. One is measurements of inflammation. That includes somatic cell count testing and automated sensors that track biomarkers like conductivity or LDH. These tell you if a cow is reacting to an infection, but they can't tell you what type of organism is causing the infection. Second type of test is an actual pathogen identification, like culturing. These traditional lab cultures and on-farm cultures identify the bacteria, and they're essential for culture-based selective treatment protocols. We also need an identification using culture to guide our preventive programs. Thirdly, we have these advanced techniques like these molecular techniques such as PCR. These tests are now commonly available, but we need to understand how they work to get the best use of them. PCR testing, for example, detects DNA fragments from both live and dead bacteria. So it's a really sensitive test for determining the type of bacteria in the milk sample, but it can't tell us if the infection is active or it's been eliminated. In contrast, MALDI-TOF is a completely different technique that's done after cultures result in bacterial growth. This test allows labs to more accurately identify specific bacterial species, especially bacteria that were previously lumped together in groups such as environmental streps. Each of these tools has a specific role. It could be identifying new infections, it could be determining if a bug is contagious, or it could be flagging chronic cows for culling. We also have to differentiate between detection versus diagnosis. Mastitis is defined as an inflammatory response to an intramammary infection. We can define subclinical mastitis based on the somatic cell count exceeding 200,000 cells per ml. In many inflamed quarters, when we sample them, they may be culture negative, which may indicate freedom from infection or simply a false negative. Tests aren't perfect, and each of them can have false positives and false negative results. Some tests, like PCR testing, are more sensitive, which means they have the ability to find more truly infected cows, but those more sensitive tests also have more false positive results. Some tests, like culturing, are more specific, which means they have the ability to reduce the number of false positives, but they also have more false negatives. The best way to use tests is to put them all together. Combine the results of tests for inflammation and infection. For example, if a cow has a consistently high somatic cell count but is culture negative, it's likely she has subclinical mastitis, but the culture result is a false negative. So you might want to retest her. The other factor that influences the interpretation of our test results is the prevalence or amount of infected cows in your herd. For example, if Mycoplasma bovis is rare in your herd, a single positive test has a low predictive value, meaning you should confirm it with another test before culling because it could be a false positive. Conversely, in a herd where you know you have a problem with Staph aureus, a negative culture from a chronic cow is likely a false negative due to intermittent shedding. In that instance, you should consider the cow to be infected until proven otherwise. So we got some key take-home points. Test results are only useful when they're used to make a management decision. And the selection of which test to use depends on the action you're going to take. So, First of all, don't do action before investment. Never perform a diagnostic test unless you have a predefined management plan for the result. Secondly, choose the right tool. Use tests of inflammation like somatic cell count to monitor the herd, and pathogen tests like culture or PCR to drive your cow level decisions. Thirdly, always remember prevalence matters. The accuracy of a positive or negative test depends entirely on how common that pathogen is in your herd. You'll want to consult with your veterinarian on this. And finally, use the right tests. Use highly sensitive tests to survey for contagious pathogens and highly specific tests to justify culling.